awaken and enlighten them with unique theme of think globally, act locally. The physiotherapy department was established in 1976 and to extend the rehabilitation services, Dr. APJ Abdul Kalam College of Physiotherapy was started in 1997. The institution is named after the excellency of President Dr. APJ Abdul Kalam sir. We are really fortunate that Abdul Kalam sir visited Pravara campus on 15th October 2005 on his birthday and distributed around 1400 floor reaction orthoses to differently abled children. This institution has specialized center exclusively dedicated to provide comprehensive care and rehabilitation of spinal cord injury patients, and the center is named after Mother of Soil, late Srimati Sindhutai Vikhe Patil, Spinal Cord Injury Rehabilitation Center. This institution also has LP student exchange program under which the student get full scholarship to visit prestigious Karolinska Institute, Sweden, and many other European universities under different programs. This institution is flourishing under the able leadership of Honorable Chancellor Dr. Rajendra Vikhe Patil sir. Before we proceed with our webinar, we must pay tribute to our and acknowledge the inspiring vision and conviction of the great visionaries who pioneered the movement of knowledge and created a future direction for thousands of our fellow beings. Our founder father, late Padma Shri Dr. Vithalrao Vikhe Patil, late Padma Bhushan Dr. Balasaheb Vikhe Patil, and Mother of Soil, Srimati Sindhutai Vikhe Patil. Now, I would like to show you some highlights of our college through a promotional video.
प्रार्थनान हेच मुचे मागणी हीच मुची प्रार्थनान हेच मुचे मागणी माणसाने माणसाशी माणसा समवागणे द्वेष सारे संपुदे धर्म जाती प्रांत भाषा द्वेष सारे संपुदे एक निष्ठा एक आशा एक रंगी रंगुदे पुन्हा पसरो मनावर शुद्धतेचे चांदणे माणसाने माणसा भोवताली दाटला अंधार दुःखाचा जरी सूर्य सत्याचा उद्या उगवेल आहे खातरी तोवरी देई आम्हाला काजव्याचे जागरी माणसाने माणसाशी माणसा वागणे हीच आमची प्रार्थना लाभले आयुष्य जितके ते जगावे चांगले पावले चालो पुढे जे थांबले ते संपले घेतला जो श्वास आता तो पुन्हा लाभले माणसाने माणसाशी माणसा समवागणे हीच आमची प्रार्थना हेच आमचे मागणे माणसाने माणसाशी माणसा समवागणे हीच आमची प्रार्थना
Thank you for watching the video. Now I request Dr. Rakesh Kumar Sinha, sir, Principal Dr. APJ Abdul Kalam College of Physiotherapy, to deliver the welcome address for today's webinar. Over to you, sir.
Thank you, Pranya, and good afternoon, everyone. So I, on behalf of Dr. APJ Abdul Kalam College of Physiotherapy and Pravara Institute of Medical Sciences, welcome everyone to this webinar of today, the topic of which is the ergonomical assessments and scope of physiotherapy in industrial therapy. And I heartily welcome the speaker of speaker of today, Dr. Deepankar Das, who is proud alumni of this college. Now we should be all proud to have him here today with us. He's working with this in this field of ergonomical physiotherapy for quite some time. That's what I've come to know. And I think he'll share his knowledge and his experiences about these ergonomical aspects in which we can work out in day to day, and it will always be helpful for all the students of our college. His work and his experiences which he will be able to share will always encourage more of our students and other members to take part in such activities. Because when we talk about industrial therapy or when we talk about ergonomical aspects, now both the things are very important. Now people in industries keep on working in different postures, different conditions with different working time. So they might be landing up with different problems and different injuries. And that is why we say we can patients from there. So we can even prevent them from coming to these departments and falling into these and having these injuries by making them aware of the ergonomic positioning, giving them a proper ergonomical advice. That is where, like we say, prevention is better than cure. Now we can prevent all the lot of problems when we give a proper ergonomical advice to these workers of industries who can take care of their posture, take care of their different activities, movements and during different activities, and prevent a lot of injuries. I think Dr. Deepankar will be able to highlight this better because he's been working in this field. So I once again welcome Dr. Deepankar. Deepankar, I'm sure the delegates and the participants will be truly benefited by your knowledge and your expertise in these fields. So the stage is yours. Dr. Deepankar, kindly please continue. Thank you.
Thank you so much. Thank you so much, sir, for this lovely introduction. I'll try my best to give my expertise and knowledge to all my fellow colleagues. Firstly, I would like to thank all my mentors and teachers to invite me for this session. So it feels very, very nice. I mean, Pravara College is very close to me.
Excuse me, sir. Just a
Haji.
minute. Yeah, we'll just do one few minutes of your introduction, sir. Then we'll.
Okay, sure, sure.
Thank you, sir. Thank you. Thank you.
Thank you.
Sorry. Yeah. So thank you, sir, for your warm welcome of our resource person and all participants. And it is now evident that today's webinar is going to become very interesting and informative. Good afternoon, all. I am Shrikant Sand, Associate Professor from Department of Community Physiotherapy. And dear participants, we all know that physiotherapy profession has lots of specialties and scope, but most of us choose to prefer some common path or traditional areas for career proficiency. However, there are few personalities who choose to travel in unexplored areas of profession and prove their expertise. Today, we have similar personality as a resource person who have not only dominated the field of ergonomics, but also have become a guiding light for many of emerging physiotherapists who wish to enter in field of industrial therapy and ergonomics. I welcome Dr. Deepankar Das sir among us today, who is a founder of PhysioErgo, a healthcare service sector company, and also a proud alumnus of UG batch 2005. Dr. Deepankar has authored a bestseller book, Ergonomics for Corporates, and also practicing physiotherapy in Gurgaon area for last 11 years, during which he has conducted more than 180 training and education programs in various industrial settings. He holds extensive experience in working for postural correction for school-going and college-going students and adolescent population. He has also co-authored many ergonomics-related books like Ergonomics for Healthcare Professionals with AIMS Jodhpur and Physiotherapy in Orthopedic and Rheumatic Conditions. Currently, he is working with AIMS Delhi for longitudinal research study for ergonomics in school-going children. He also appeared in a web series Caught in the Web by Sandeep Maheshwari, the famous personality coach. So with tremendous pleasure and curiosity, I welcome once again and request Dr. Deepankar Das sir, please to continue with your session. Thank you, sir.
Thank you, sir, for this lovely introduction. It feels really, really great. And I mean, I love to visit soon this college. I always miss this college. I mean, आज तक भी बहुत because as you rightly said, ज़्यादातर लोग traditional path use करते हैं, and then we hardly take this what do you call physiotherapy as a practice, right? So, but in my case, I was also looking for MBBS dental मुझे करना नहीं था, and then I was looking for other than MBBS. So I mean, I was just visiting my friend. I mean, जैसे मैं इंडिया में घूम रहा था for my admissions in MBBS in different states. So I mean, thought of visiting my friend. He actually got into MBBS. So there I got to know this physiotherapy field that actually exists. I didn't even know कि physiotherapy होता क्या है in 2005. So, and luckily I'm very blessed. After that, life has been changed. So I'm so blessed about having being a physio and acknowledged. I mean, all my mentors and I mean, thanks to all my mentors and teachers in Pravara in my master's degree as well. So that's about my journey and how I changed my field from cardio to ergonomics, because during my internship, one of my teacher told me, why don't you do these sessions in your metro cities, which is Delhi NCR. There you can get a lot of attention and a lot of appreciation. But having said that, it was very difficult for me to pitch all the corporate without any references in the early days, because those time ergonomics का ज़्यादा scope awareness था नहीं. But now after Corona happened, it was a kind of a blessing in disguise for me. And then now people are asking, a lot of awareness of ergonomic chairs, especially the work from home people. So all this journey and everything, it's totally worth it, and I really enjoy and very proud to be a physio. So let me just share my screen, and this session is probably kind of a can you see the screen?
Yes, sir. Yes, sir. Yes,
Okay,
sir.
perfect. So I'm just I just wanted to start this session by this famous personality which everybody might have inspired in one of the other way in your lifetime. The only way to do great job work is to love what you do. So ergonomics is what I love, and this is what I know deeply. So that's how I do this day in day out. And you will be surprised to know I talk about ergonomics to each and every person who comes to my path, whether it's clinic or whether it's my professional or outside clinic or personal life also. So sometimes people also tease me कि यार तो हमेशा यही बातें करता रहता है. So it happens. So when you love what you do, so it happens everywhere. So you try to make things possible. So because ergonomics is very vast subject and it's difficult. And काफी फिजियोस पूछते हैं कि सर क्या स्कोप है इसका, फिजियो का क्या स्कोप है, एंड आई ऑलवेज से कि फिजियो का स्कोप तो बहुत ज्यादा है. I mean, it's not even yet explored yet. If I talk about only the ergonomics, तो ergonomics में बहुत ज्यादा scope है, right? So one second. So hi, my name is Deepankar. I help achy, stiff, slouchy professionals to improve their posture and the body function. So this is my quote. I've written more than 65 quotes yet. So the more you invest in ergonomics, the more you will enjoy a pain-free life. So this is my topic: ergonomic assessments and scope of physio in industrial therapy. So let us understand what is ergonomics. I hope everybody knows about ergonomics. So simply put it in one line, which is rules of work. जो भी आप काम कर रहे हो, whether it's standing or sitting, how you can make yourself comfortable to your work environment. So that's how. Maybe you're sitting or maybe you're standing. अगर एक security guard खड़ा है, तो how what are the things he can do to make himself comfortable ताकि वो 8 घंटे तक खड़ा रहे. Similarly, if somebody is working in a sitting job or work from home for 8 hours, how he can make himself comfortable to work for 8 hours without pain. So this is all about ergonomics. So ergonomics ज़्यादातर designing में आता है. So whatever you see in and around your lifestyle, so you will see each and every product is designed ergonomically, whether it's mask or whether it's your car or maybe airlines, anything which is you see in day-to-day life, or maybe a jar or maybe glass or maybe bottle, everything is designed according to a user friendly. So so let's talk about so there are more than 100 professions now there, and you can, if I talk about the approach, if I talk about the scope of this physio and ergonomics per se, so there are many professions you can think and do a market research and do a micro niche and stand out in terms of, let's suppose if I talk about one profession, which is, let's say, hairdresser, or one profession, let's talk about dentist. So dental ergonomics, if you expertise in dental ergonomics, there is huge scope. I would say there is huge scope, because I have seen I'm doing these sessions for various professions, so that's how I know how these fields can emerge. So the stool which I'm sitting, which is a saddle stool, which is a dental stool, and this cost around 40,000 of rupees. These are the products you can recommend to your profession, to your colleagues, to your dental clients, right? You can design your dental, you can design their dental clinics, how ergonomically sound. And so the point I'm saying is, अगर आप एक प्रोफेशन में एक ergonomics is a major field and उसके नीचे बहुत सारे expertise हैं you can master. For example, if you are master in ergonomics in dentistry, तो आपको पास जो target audience होगी, that would be your dental practitioners, या dental schools या dental I mean colleges, right, masters and bachelors both, वहां पे आपके पास बहुत ज्यादा scope होगा to actually explore and flourish, right? So these are the products you can recommend. You can ask for sponsorships and many other things. So same goes with different professions, right? And there's another field which is aerospace ergonomics. It's a huge field. So I'm just talking about vast. I was talking about this dental ergonomics. There's a ergonomics for hospital industry also, and there's a industry for education, which is for colleges and schools. After COVID, my consultation, my OPD has been increased by 40%, especially for kids, somewhere around 12 to 15. So kids are having these kind of issues because of these screen time and postural issues, because of sitting in front of computers and tablets and studying online. So there is a huge scope of having these increase your availability, increase your expertise in these sectors. So I strongly recommend, because आने वाले टाइम में स्मार्टफोन रहेगा, एंड स्मार्टफोन की वजह से सारी प्रॉब्लम्स हो रही है, whether it's physical health or maybe mental health. So you can start focusing for the preparing for the future. So that's how I would talk about कि let's say अगर आप डेंटल में भी करते हो, maybe education sector में भी करते हो, maybe you only do the posture assessment only for the kids. So because micro niche रखोगे, बहुत narrow market रखेंगे, ज़्यादा better है, rather than you serve all of the age groups, right? Next is which is today's topic, which is the industries, which is factories, right? So there are various types of assessments which you can do in the. So I'll talk about only the assessment of the factories, not the other, because it will take longer time. So since my topic is industrial, so the assessment will be related to the industries. So assessment can be systematically conducting an ergonomic risk assessment. आप एक बार गए एक फैक्ट्री में, and then just take a quick glance कि whether people are sitting or standing, how the way are sitting, how the way they are sitting and standing doing their jobs. Quick glance, you can get an idea कि क्या हो रहा है, कहाँ गलतियां हैं, what are the risk assessments, what are the risk factors. So there are various levels of ergonomic risk assessments. Once you get into the factory, once you get into the industry, you will get a clear picture of musculoskeletal risk factors, which will give you a guideline of communicate and how you can prioritize, how you can implement the workplace improvements. Right. So there are three types of assessment, which is hazard recognitions. Hazard, which is one first line of screening. Second is the simple risk assessment, which is more in depth screen identifying risk factors for each body segment at the job level. Whether the person is pushing or pulling, whether the person is doing a repetitive task or something like that. Third is very detailed one, which is objective assessment, जहाँ पे आप you do a quantitative tool with the help of like Rola, Reba, and Niosh. So these are the tools which is so these tools will have a lot of it takes a lot of time and effort with one assessment. So let's talk about hazard recognition, which is hazard में क्या क्या आएगा. So if I talk about industries, तो high forces, जहाँ पे आप बहुत जोर से force से काम कर रहे हैं, awkward postures में बैठे हैं, और या maybe खड़े हैं, और maybe आप push कर रहे हैं, pull कर रहे हैं, anything which is repetitively you're doing, let's say, or maybe it's a अगर कोई भी repetitive काम कर रहे हैं, let's say नीचे से ऊपर उठाना है, ऊपर से नीचे उठाना है, रखना है, और maybe यहाँ से इस पोजीशन से आप इस पोजीशन तक रख रहे हो, irrespective of the weight. So let me just give you an example. So one of my client, so this is a company called MMTC PAMP. They are into silver and gold refinery. So वहाँ पे मैं जब गया, so one girl was sitting like this on a higher stool, and she was doing filtering the gold grains of hardly 1 gram of from one position here to here. So this was her positions. So this was her task. ऐसे वो यहाँ से उठाना यहाँ से. So what are the chances of having the problem? Uska right shoulder was stiff because of this repetitive motions. Though the task was very light of 1 gram, but repetition was high. Same goes with the vibrations. One person was doing a job where lot of vibrations coming from the machinery, and there is some like contact stress where you end up sitting or maybe exposing your body into the edge. I mean, let's suppose talk about wrist. So wrist, if you are putting a wrist on the edge of the bed or maybe chair or maybe table, so that causes a contact stress. And some people are sitting and working on the cold extreme temperatures, high, I mean, heat or hot and cold temperatures. So these were the simple. So first talk about simple risk assessment. So the goal of this assessment is to identify and document levels of MSD risk factors for each segment of the body. For example, like I told you, जैसे हम जाते हैं तो एक assessment में हम गए और देखा simple assessment में कि how many people are standing, how many people are doing a job while sitting. So this comprises from the moment you enter the factory. You have to acknowledge, you have to see the security guard as well, because आपको वो project मिला है पूरी factory को assess करने का, not only the people who are blue collar workers. So white collars and blue collars दोनों को आपको assess करना, not only the white collar workers, right? So आप उनको सबको assess करोगे, देखोगे, and then you can evaluate using any kind of tools. So objective assessment में क्या होगा कि objective में it's a detailed one. You need a lot of team and lot of bandwidth of manpower and everything. So there are various types of scales which are available in the market. But I mean, since it takes a lot of time and a lot of manpower, these are the companies like BMWs, Mercedes, Bosch or SAC companies में इनके assessment होते हैं, because they need a lot of time to actually maybe 1 to 2 years of assessments. So NIOSH lifting equation, Visha lifting calculator, RUBA and REBA. I mean, rapid upper limb assessment and rapid entire body assessment and Snoop tables. So NIOSH is used for occupational health and safety to assess manual material handling risk associated with lifting and lowering tasks in the workforce. So this tool is used for only where the handling of lifting is required and any kind of lower task is required. Visha is where Visha or NIOSH is quite similar. Both are risk assessment are widely widely used for the manual lifting and the lowering task. Rapid entire body assessment is very, very common, other than rapid entire upper limb assessment. Frankly speaking, I personally don't use any of the tools because it takes a lot of time and, as I said, manpower, and companies do not have the time, especially the IT sector do not have the time for all these sectors and all that, because they want the quick result for their employees. So this tool is used for systematic process to evaluate whole body postural musculoskeletal disorders, and it's a simple single page form which you can nowadays, so it's a quick assessment tool is required, where you can install on your phone, and everything is in that tool. You can just see the person's posture and just quickly enter the fields and automatically you get the results. So there you can get the score of each and every body, which is like say wrist, forearms, elbows, neck, trunk, back, legs and knees. So once you get the data and the score, the table on the form are then compiled to get the risk factors variables, right, which will give you the score of this REBA. So REBA is basically to provide a simple posture analysis. It is to divide the body into segments, wrist se lekar ankle tak, head se lekar ankle tak, you can divide into different sectors. and to provide the scoring system for muscular activity cause static, dynamic, rapid changing or unstable postures. So it is to give you the action level output with an indication of urgency, right? So this requires less time compared to other tools. So it is a very user friendly assessment tool which requires hardly any time and minimal effort and equipment. So this is a tool which I was talking about. अगर आप closely देखोगे इसमें section A which says neck, trunk and leg analysis. So आप किसी को भी आप observe करोगे, you can easily see कि how the angle, how he is sitting, whether he's sitting on the chair or maybe standing, उसका neck का angle क्या है. So let's suppose if the angle is 20, so you can just tap it on the calculator, which is +2. Similarly goes with the other trunk, how is bending, reclining or declining, or kitna angle hai, uske basis pe you can just add these pointers. And step 3, which is the legs, and then step 4, which is look at the posture score in the table, this AVE. यहाँ पे आप इसको calculate करके then you will get the scoring. So definitely it takes a lot of time to in detail to explain all this tool. So this is the type of score you will get. If somebody scores is 8 to 10, so he is at very high risk. You need to investigate, you need to implement changes. Change implement करने से पहले you have to send the report file to the HR and admin so that they can get the changes done. Let me just give you another example. One of my client, उनके factory में एक this what do you call canteen थी. So canteen में, so there were around 200 chairs were there, and mostly उस canteen में सबसे ज़्यादा वहाँ पे बाहर के expats आते थे, and then they do the जितने भी मीटिंग्स पावर पॉइंट और जितना भी प्रोजेक्टर पे मीटिंग्स होती थी वहां पे होती थी. एंड ईच चेयर सारी की सारी प्लास्टिक की चेयर्स थी, एंड देन प्लास्टिक का अपर पोर्शन वाज प्लास्टिक, एंड द नीचे का जो पोर्शन, जो उसके 4 स्टूल्स के जो 4 हैंडल्स हैं, सो दोज वर आयरन. सो उसके नीचे का रबर वो खराब हो गया था. बिकॉज ऑफ दैट इतना ज्यादा शोर होता था, बिकॉज ऑफ दैट दीज चेयर्स, क्योंकि कोई भी आता था फिर वो उसको ड्रैग करते थे, देन ऑटोमेटिकली इट वाज अ बिग मेस और बहुत ज्यादा नॉइज पोल्यूशन होता था. दिस आल्सो कैन बी आइडेंटिफाइड देयर एंड यू कैन इम्प्लीमेंट द चेंजेस. यू कैन जस्ट नोट इट डाउन एंड इम्प्लीमेंट, गिव द रिपोर्ट टू देयर HR admin, right? So these are the things you need to talk about. कि कितना टेम्परेचर है, कितना आपका वॉल का कलर कौन सा है, कहाँ पे आप काम कर रहे हो. फॉर एग्जांपल अगर अंदर काम कर रहे हैं तो हमें देखना है कि वॉल का कलर बहुत ब्राइट तो नहीं है, बहुत डोमिनेटिंग तो कलर नहीं है बहुत ज्यादा. और सिमिलरली टेम्परेचर, सिमिलरली योर नॉइज, एवरीथिंग हैज टू बी कैलकुलेटेड, राइट? सो रेबा इज रैपिड, उसके भी कुछ लिमिटेशंस हैं. So REBA does not consider the duration of the task, available recovery time, or evaluate hand-arm vibration risk. Another limitation is it only allows the evaluator to assess one employee's worst case posture at one point in time. You can't assess 2, 3 or more than 5 employees at a time. So that's how that's why I'm saying कि इसमें बहुत ज़्यादा time लगता है to assess each and every employees. If a company has a strength of 1,000 employees, so it will take a longer time to complete the project. So that's how you need more manpower and more advanced tools. And it requires separate assessment for the right and left sides of the body. Although in most cases you will be able to do a quickly assessment which side of the body has the greatest exposure of the MSD risk. Now talk about rapid upper limb assessment. Again, it's as the name suggests, rapid upper limb, which is only for the upper limb. This tool assesses postural load requirements of the job, which demands on the neck, trunk, and the upper extremities. Same, it is also on the one page, and iska bhi ek scoring hota hai, which you can take with that particular form. Rula is a method for, again, a significant assess the exposure to significant risk of work-related upper limb extremity disorders. So जो मैंने आपको example दिया था, that lady was sitting and 1 ग्राम का gold यहाँ से उठा के वो side में रख रही थी. So that was the case where you can use this tool, right? Next is to identify the muscular effect which is associated with working postures and excessive forces which perform static and repetitive work. To provide a simple scoring method, and it is also a user-friendly assessment. So this is what is Rula looks like. Similar to Reba, but Rula is only for the upper, which is upper arm positions. This is lower arm position. This is the step 3 is the wrist positions. And this is section B. You need to find out neck, trunk, and leg analysis. And this is now you need to locate. So there are easily written step 1 to step 15, and then you can assess and just mark 2, 3 all the numbers compare. I mean relative to the postures which you are assessing, and then you will get this kind of score. Again, if the score is 3 to 4, low risk, change may be needed, but in each cases you need to find the report and send it to the HR admin. This assessment is also has some limitations, which is it does not consider the duration of task. Again, इसमें भी आप एक ही employees को एक ही बार में कर सकते हो. You can't do multiple, and it also another limitation is that it requires separate assessment for the right and left side of the body. Right. Next tool is Snoop tables, which is designed for various lifting and lowering, pushing and pulling, carrying task. ये ज्यादा होता है जहाँ पे हमारे पास जो assembly line में काम कर रहे हैं factories में specifically. It's a little difficult tool, but nowadays, as I said, आप आजकल वो बहुत सारे calculators आ गए, automatically you just have to fill, and then in some tools you need a camera to actually click the pictures and then assess something like this. So these are the awkward postures. So like this person is sitting and extending up, like their neck is extending. So this guy is doing flexion. This is side bending. So here you can click the pictures who all are sitting in their awkward postures, right? Shoulders, lower back, wrist. For documenting all this takes lot of time. ठीक है? Physical exertion, कौन lifting कर रहा है, कौन कितना overhead shoulders के काम कर रहा है, कौन pulling कर रहा है, pushing and then carrying, कौन hand arm vibration का use कर रहा है, and other exertions, कौन contact stresses के वहाँ पे impact जहाँ पे ज़्यादा आता है, जैसे for example screw है, आपका कुछ machinery है, कुछ भी. So these are the types of to assessment scale you can get. So this I got this from the Ergo Plus website. They have the tool, so it's not in India. So you can just assess their tools for take the subscription of these tools and for any of the projects, right? So here in the first section you can write it down, your force of that particular person and what he is doing and how the postures. अगर आपको इस पे क्लिक करोगे तो ऑटोमेटिकली एक ड्रैग डाउन आता है and you can easily select where the problem is, and now you will get this scoring according to that whatever field you have assessed. Now the objective assessment, which is NIOSH, which is lifting equation. इसमें भी it's a though I find it very difficult lifting equation, but I personally don't use these tools because of timing issues. So these are the scoring you can do. Maybe in some other time, if we are doing advanced ergonomics workshop, then we can discuss in detail. But just to go through, just to tell you in very simple words. So in different areas, you have to capture the body posture. Horizontal location of the hands, जैसे for example इस case में अगर if the person is standing, आपको उसको हॉरिजॉन्टल में कैसे काम कर रहा है, पीछे से देखना है, फिर साइड में से देखना है, एंड देन अपर उस पे कि आपका एंगल कैसा है, हाउ यू कैन reduce and mitigate all the risk factors. So something like this example. So this was this is not my client's picture. This I got it from the Google. So just for example, आप अगर कोई भी person is lifting this object, whether it's 5 kgs or 10 kgs, वो नीचे से उठा के pick कर रहे हैं, and then he is lifting and put it on the table. So इस task की इस journey को you need to capture and then assess according to the body this NIOSH table. And again, if I talk about the lowering part, पहले नीचे से ऊपर रख रहे हैं, आप ऊपर से नीचे रख रहे हैं. Again, you need this tool is very beneficial to assess these type of cases. इसमें भी आपको गोनीमीटर से काम करना होगा, और मे बी एडवांस टूल्स विच आर देयर वेयर एक्सटेंडेड रीच का बहुत ज़्यादा काम होगा, वेयर again in big factories and assembly line where manual labors are very prominent. Something like this is called upper arm high end vibration, जिसमें vibrations हो रहे हैं, and then you are doing some kind of activities in overhead shoulders. Your distance between your body and the hand is above, and which causes strain on your shoulders, right? So this type, this is the type of look and feel of these Snook tables. So this is a proper ergonomic tool, Snook table for ergonomics brand, ergonomic table, Ergonomic Plus. This is the company who has this tool. Another which is similar to Snook table, which is NIOSH and Visha lifting calculator. Again, if you see, there are step 1, step 2, step 5. You need to just take, let's suppose first you need to take the weight of the object of the employee, which is what object he is lifting, uska kitna weight hai, and then you need to determine ki uska weight ka limit kitna hai, and then step 3, how you can reduce the limit. So this is the scale you can take कि आप वो कितने दिन का, फॉर एग्जांपल जैसे मैंने एग्जांपल बताया था, वो लड़की कितनी पूरा 8 घंटे में कितनी बार रेपिटेटिव काम कर रही है, एंड देन हाउ मेनी आवर्स ही इज डूइंग, जॉब रोटेशन हो रहा है नहीं हो रहा. So that's how you can calculate for this with this type of this thing. So here is you can easily correct this. How you can, one way of doing is assess, and then you can educate the right way of pulling and right way of pushing, right? So after all this, what you have to do is, the next step is improvement of the assessment. First we need to what we have to do is, first we need to observe, which I said, assess the risk. You need to conduct all these risk assessment, quantify all kind of musculoskeletal risk factors, then you can plan the improvement. First आपको prioritize करना है and the plan workplace improvement करना है for any kind of projects. Then you can do is you need to execute your project, execute your improvement, make some improvements to the workplace in the time manner. Something like, for example, ऐसा नहीं कि आपने उनको timeline दिया है कि 2 महीने, you are completing in 3 months, which should not be the case. Do in a timely manner and make the improvements very fast, and make sure you are checking again and again, and conduct your, which is again the recheck, conduct post improvement assessment, just to you are confirming how you can how you have reduced the risk factors. And last is share all the report to the concerned team for the entire this thing assessments. And that's about it. This was my time, and thank you so much for listening quite and I am ready for all these, any of the questions if you have. I know it was quite what do you call, theoretical, but this was the topic, I can't help it. So any questions?
Thank you, sir. Now we are open for question answer session. So if you want, you can ask questions by raising your hands, or you can just put a question in chat box. I will read it for you. Uh, you can also share your doubts with directly on our email. So please raise your hands if you have any questions or doubts. Okay, so we have the question, sir. Does REBA calculator require subscription? So is it paid or free?
So no, it's not free. Though, I mean, if you wanted to have calculate with the tool, so then you can purchase, or for one. So in some companies they ask for project wise, in some companies they ask for yearly subscription. But for REBA, अगर आपको वैसे करना है, just take out the printout from Google and just let's suppose if you are doing a assessment for 100 employees, so आप 100 printout निकालो and then you can do manually also. So that's how you can save money in the cost of for the employees. How to decide which scale to be used for specific? So as I said, with scale, for example, अगर आपका industry है, factories है, तो you need to do NIOSH. And if you have the standing and sitting both whole body, so then you have to do rapid REBA. And if you have if you are doing a maybe, so then you have to do a ruler. I hope you got my answer, Dr. Deepti. Sheetal is asking any courses in ergonomics. There are many courses. Which course you wanted to do? What is your interest and which field? So I would suggest please narrow down your market in if you want to explore ergonomics in any of the field, because जो मैंने गलतियां करी थी please वो मत करना, because I have done a lot of mistakes. अगर मेरे को बोला जाए, अगर I have to go back 12 years back, so I would have done, I would have explored only one market. Let's say maybe IT, maybe kids, or maybe any of the niche. What are the career options in ergonomics? So there are many career options. I mean, as I said, मैंने सबसे पहले starting में बताया था ना कि dental का, aerospace का, education sectors, right? Profession wise, architecture, schools and colleges. So don't do. So सबसे ज़्यादा दिमाग में लोगों को ऐसे रहता है कि ergonomics मतलब जब भी ergonomics का word आता है, ergonomics मतलब presentation in the boardroom in the IT sector, which is not the case. Ergonomics में you can explore anything. So you can do n number of things. Let's say designing of the product. For example, I was helping one of the startup जो अभी शार्क टैंक इंडिया में भी आए थे. So उनका जो प्रोडक्ट था, I was helping as a ergonomic consultant to make that product ergonomically sound. तो आप एज ए कंसल्टेंट भी किसी कंपनीज में आप रह सकते हो, और मे बी यू कैन गाइड देम फॉर देयर प्रोडक्ट्स, फॉर देयर एज ए कंसल्टेंट इन देयर कंपनीज. Another example, I was helping one of my friends. So he was making a what do you call this robotic arm में for to help them all neurological patients. So वहाँ पे आप research में भी आप काम कर सकते हो, आप designing में भी काम कर सकते हो. So it has a lot of scope in this. I hope you got my answer. Janvi Kulkarni, I guess she asked this. All are unmuted. Please raise your hands. Okay. Which is the scale to be used for employees with desk job? Ruler. Prachi, it's ruler. Hi, sir. For clinicians, which course of ergonomics is suggested? So again, I'm saying don't make mistakes. You don't have to practice. Side by side for if you are practicing ergonomics. So just go full flow outside in the market and do ergonomics, only ergonomics, and explore the world, right? So for clinicians, there is no particular course. It depends on. I would suggest you can visit different countries. वहाँ पे MSc के courses होते हैं. वहाँ पे you can suggest, because इंडिया में क्या है कि यहाँ पे सब everybody is doing chiro, everybody physio is doing chiro, physio is doing osteo, physio is doing dry needling, physio is doing kinesiology, physio is doing ergonomics. बाहर ऐसा नहीं है, बाहर सब कुछ अलग है. So there is a person who is ergonomic consultant, वही ergonomics करते हैं. That person is not a physio, वो MSc ergonomics में है, right? So यहाँ पे the means scenes are different. So that is a benefit of having in India. I hope you got my answer, Dr. Aditi.
Dr. Akshay, you can unmute yourself.
Hi. Hi, good afternoon. I am Dr. Akshay Mathur. So
Hi, sir.
my interest for today's webinar was actually speaking, I am working with a multinational company as an ergonomist.
Perfect.
So I'm full-fledged working in an industry right now, and I am using all the skills which I can see right now. Reba, Rula, Niosh. I
Right,
am
right.
doing it on a daily basis. I
Perfect.
just could not find a suitable course for certification in this. So I just wanted to know if you have any certification course that can be an added benefit to me in this field.
Oh, okay. So since you wanted to explore this in this particular company or with other industries also?
I am working with an automotive firm.
Okay.
So yes, I would be more interested in enhancing my knowledge and my certifications in this company related.
Okay, so I'll help you in that. We can discuss offline also. You can have contact me offline. I'll help you out. I have some
That
options.
that is really nice of you.
Anytime.
So how do I get in touch with you? Is there any way I can get in touch with you offline?
Yeah. So okay. So Dr. Shrikant आपको मेरा नंबर दे देंगे. You can just
Yes, yes.
contact, है ना?
Yes, sir. Yes, sir.
Shrikant sir आप दे दोगे, है ना?
Yeah. I'll message Dr. Akshay the email address and number. Yes, sir.
Right.
Yeah. Thank you so much. That would be
Okay.
very nice.
Thank you so much. Dishika is asking what scale can be used for techniques in. So there is no specific scale for specific problem. So again, which is, I would say, ruler is the best options available.
Okay. Thank you, sir. Thank you
Yeah,
very much.
thank you so much.
We'll hold a question and answer session. There are a lot of questions, but we'll give little hold to that. Thank you very much, all the participants also for the response. Deepali ma'am, do you want to say
Yes.
something? Yes. Thank you.
Good afternoon, everyone. And it's always a pleasure, Dr. Deepankar, to listen your lectures. And I really feel proud that the way you have,
Thank you.
you have reached in your field, though you have done your master's in cardio, but you were having something about ergonomics, which was developed in your UG days, and that tapped your mind that you have to work in this. And in the starting of your presentation, you said that during COVID pandemic, the importance of ergonomics has improved, and that's a really truth. And I also feel that the students who are going to be a physiotherapist, they should keep this thing in their mind, because during COVID time, when most of the private practitioners, they were not able to practice normally. So the students who have passed out or they have done post graduation in other fields, they have called me to ask about ANC and PNC classes. क्योंकि कोविड में पूरी दुनिया थम गई थी, but females were getting pregnant, और ये मतलब it's nature और ये चलने ही वाला है.
So always, whenever you are going to work or whenever you are going to choose a field, you have to also now consider that tomorrow it may happen. Even
Right.
WHO is saying that these kind of pandemics are going to come. So I really feel that the point which you have raised about a pandemic और उसमें ergonomics का जो importance है बहुत ही ज़्यादा बड़ा है, and I
Yeah,
feel
yeah.
that the people who are having real keen interest, those who are good communicator, good orator, they should actually try for this field. जैसे तुमने
Yeah.
बोला कि for physiotherapist we have so much of area where we can
Exactly.
can work, so you can you have a second option for this. And one thing I would like to tell you that it is not the institution who are great institutions, but I feel that the alumni, तुम्हारे जैसे जो alumni हैं, those who are working very dedicatedly for the field of physiotherapy, because of you alumni, I feel that the institutions are great. And all the students who are listening today's webinar, I really feel that you can take this inspiration. And nowadays the students, they feel that everything should come very fast, and life is also very fast nowadays. So
Yeah.
seeing you all, we know that you have to put some your dedication, and you need to put your patience, you need to put your hard work to get and to achieve something. So whenever we see alumni like you, हमें इतना अच्छा लगता है. And I think Deepankar, you are still there in our website. Website में तुम्हारा एक geriatric home में जो visit होती थी
हाँ जी, हाँ जी.
तभी से जो चल रही है, वहाँ का एक photo है. Just few days back I have seen that picture. So I feel that, I hope that you have enjoyed, and once everything physically जब start होगा, so
Yeah,
we
yeah.
can have something. And even this year we are celebrating 25th year of establishment of our college. So hopefully अगर COVID ठीक बनता है तो maybe during Diwali time or before Diwali we can have something, so we all can meet. So I would, and since 1.5 year I think हम लोग ये plan कर रहे थे कि हम लोग lecture रखेंगे 2-3 times.
हाँ जी,
हमारी बात भी हुई, लेकिन फिर हर चीज के लिए एक वक्त रहता है. So thank you so much for your time. And I
Anytime,
request, yes, and I request Shrikant sir to continue.
Thank you, sir. I request Principal sir to start the video so we can take a screenshot of all of us.
Yes, you can.
Yes. Thank you, sir.
So thank you all. Thanks a lot, Dr. Deepankar, and hopefully
you, sir.
we'll have a lot more sessions, because that's a good thing. Because to be in, that's why I told Dr. Deepali, we should have a constant contact with our alumni. That's the best thing which can happen, because you all can help in and because both of us can be mutually helpful to each other in a lot of ways. Our students can learn, even you'll enjoy by coming back to your college days, memories of the college. So that's the way both of us can be benefited. So that's
Anytime,
good to have you there.
Thank you, sir.
Good afternoon, everyone. Myself, Dr. Nupur Kulkarni, Associate Professor from Department of Community Physiotherapy, take the privilege to propose vote of thanks for today's webinar. I'm extremely humbled and honored to thank our Honorable Chancellor, Dr. Rajendra Vikhe Patil sir, our Honorable Vice Chancellor, Dr. V.N. Magre sir, for guiding and supporting us in this significant affair. I express my sincere gratitude to our Principal, Dr. Sinha sir, for his constant support. I would like to extend my deepest gratitude to our guest speaker, Dr. Deepankar Das, for enlightening us with his knowledge. My heartfelt thanks to all the teaching staff for their valuable contribution and encouragement in all our efforts. I owe special gratitude to our IT department, because of whom this webinar was conducted smoothly. Last but not least, I would like to thank all the participants, without whom this function would not have been a resounding success. So thank you very much, everyone. Thank you.